Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Dr. David Nash, who is a founding Dean Emeritus at the Grandon Professor of Health Policy at Jefferson College of Population Health, and he is also the author of How COVID Crashed the System. Thanks so much for being here.
Great to be together. Thanks for having me.
We are so excited to talk to you, and you are such a well-known figure in healthcare, but you recently had a chance to be on the other side with a spinal surgery. So why don't you tell us, what was that like, being somebody who has now been in the full spectrum very recently?
Yes. Well, first of all, great to be together, and thanks again. And yeah, wonderful. So I've been at Jefferson for 33 years on the faculty. So I'm a walking, talking dinosaur, Stephanie, and that's what my millennial children think of me anyway. But 3.5 weeks ago, I had a second spinal fusion surgery at Jefferson. Here's the short story. 20 plus years ago, when I was a lot younger, I had probably congenital spondylolisthesis. Don't ask me to spell it, but for our viewers, so that's one vertebral body sliding on top of another. So at L5S1, I had this spondylolisthesis, very high grade, and the symptoms were pretty terrible sciatic pain. And if anybody's ever had sciatic pain, which is super common, it really hurts and it travels down your leg. And then eventually, 20 years ago, I couldn't walk. And so I had an L5S1 fusion. And as it turns out, these things typically sort of last for 10 to 15 years. And then the spine being how it's designed, typically the joint space above the old fusion is trying to work against a fixed thing. And in a nutshell, I ended up having this past summer, I was running and playing tennis and had a new grandchild and was super busy. And very sadly, I ended up having pretty bad sciatic pain again. And I knew all what it meant. And I did all the things you're supposed to do. I had physical therapy, I had an epidural, and then the punchline on October 9th, I had to go. And my hardware was so old that they had to take all the old screws out and put in all new screws. So by this point, I know you're having back pain just thinking about this. And I outlived the hardware. Yeah. So as the
You're bionic now.
Yeah, I'm totally bionic. As the neurosurgery chief resident came by at Jefferson and said, your warranty is up. And we're going to take out all your old stuff and put in all new stuff. And I'm like, oh, man. So that's exactly what happened. I went in with 4 old spinal screws and came out with 4 brand new ones. And I'm smiling now, but this is not for the weak-kneed. I mean, spinal fusion surgery is no fun. It's much better today than 20 years ago on a host of different levels. But the good news is this time they made me walk in the hallway on post-op day 0, which is a fancy way of saying I was first case on a Monday morning at 5:30 in the morning, in the OR at 7, in the PACU at 10:30, in my hospital bed at 1:30, and 3 o'clock that afternoon, it's like, okay, David, time to walk in the hallway. So, that's exactly what I did. And I knew in 5 minutes that my sciatic pain was gone. And so that's a great outcome. And, being a patient in your own place, that's a little odd. So not that every nurse knows who I am, certainly not. But they roll me into anesthesia and the faculty member says, hey, David, what are you doing here? Great. And so I knew the surgeon and my surgeon, Jim Harrop, who's really well known, I remember when he was a resident. So, Ike's, so the surgery, the anesthesia, I got great care. And we're a spinal cord center. So it's pretty well organized. And I had nurse practitioners and case managers. I mean, so many people visited me. I always tell people, bring a pad and a pen to the hospital because you're not going to remember, and sure enough, I had to write it all down because it all was like a blur. Last time I was inpatient for 4 nights, this time 2 nights, and that's actually a lot safer for everybody. On the other hand, it was such a rush. It's like, okay, hi, I'm your physical therapist. Hi, I'm your case manager. Hi, I'm going to give you your durable medical equipment, and I'm your and get out of here. So it was kind of hairy, but yeah, I'm lucky to have access to great care. Lucky to have great health insurance, right? So got to be thankful for all of this because there's plenty of people with back pain who are never going to have the access and the opportunity that I had, and that's pretty sad.
It's also a testament to the other advancements that there must be, because as you said, you're 20 years older and yet you still had half the recovery time, which is pretty amazing.
Stephanie, thanks for reminding me. Right. So the care is different, as our listeners surely could appreciate. I mean, 20 years ago, they totally snookered me with OxyContin for weeks and 10 milligrams of Valium every night. So I don't remember anything from 20 years ago. This time, and they did a iliac crest harvest of bone, which hurt for 2 years. This time, I think I had 1 oxy, some antispasmodic medication, all of which is new, and then cadaver bone and all new screws. And I mean, it was hairy, but that contributed to being able to walk that same afternoon. And just to close on this, you can't do therapy. You can't do physical therapy for 12 weeks because, you still kind of bolted in. So the therapy is to get outside and walk. And so I'm quite a sight. I have my cane, I have my back brace, I have my bone stimulator, kind of like a TENS unit. And I'm out there walking in the neighborhood. So on Halloween, my wife said I dressed up as a patient.
Incredible. Glad to hear that you had such a positive experience, and 20 years later
Yes, I'm very grateful. I mean, I can laugh about it now, but I'm truly grateful to the team, to Dr. Harrop, to the nurses. I will say, Perv, as a doctor who's been on staff for 3 decades, I had 2 great experiences, and to be visited by people who care a lot about me was great. And special shout out to my longtime colleague Gino Murley. He's been there forever, and having him visit, I mean, that's the highlight. That's what you remember.
Well, that's what I was going to say, David. I mean, it's an incredible story on a personal level, but then if you think about it in terms of your professional career and what you the world, population health, and as you're known, I don't know if we introduced you this way or not, but the world knows you as the father of population health, really, for what you've done. Incredible. So do you feel like your experience this time was sort of population health in action?
It's a great question. I think the answer is certainly partially yes. I mean, these guys and gals have done a lot of outcomes research. Dr. Harrop has his own 1,000+ registry of patients. And so he has some pretty good evidence about what to do and what not to do. 20 years ago, it was before the spinal outcomes research trial, the SPORT trial, didn't come out till 2005 or 2006. And Todd Albert, who was my surgeon back then, I mean, he was a part of the SPORT trial, which was the lead article in the New England Journal, but that came out after my surgery. So, they started really taking this seriously, let's call it almost 20 years ago now, to look at, well, what are we really doing here? How long do you need to be in a brace? What's the outcome of physical therapy? What kind of pain meds? What sort of bone cement? So I give these folks a lot of credit for looking in the mirror and saying, now we have some evidence of what we're supposed to do. That's great. Imagine if we could apply that to everything, right? Mm-hmm. So you got to give credit to mostly the neurosurgeons and orthopedists who do this kind of work. And we also have seen, on the other hand, huge increase in the number of spinal fusion surgeries every year. Mm-hmm. So we got to be a little thoughtful on patient selection criteria, right? And also we got a lot of 80, 85-year-olds getting spinal fusion. I mean, it's tough enough at 68. I wouldn't want to do this in another 20 years. No way. I mean, hopefully not, because, you're not making bone, you're fragile, the recovery's a bear, you're going to lose all your core strength. I mean, I was in great shape all summer, from working out, and you got to be, because it's all core strength moving forward. Anyway, mm-hmm. I think the sport trial was the beginning of a lot of research and measurement on what are we doing here every day. Mm-hmm. And as all of our clinical listeners know, so much is religion here, and meaning this is what we always do. And it seems to work, so we're just going to keep doing it instead of let's figure it out. And I'm grateful, and I'm a beneficiary of let's figure it out. And I'm happy to be a part of any registry moving forward, for sure.
Excellent. Really great to see science in action, evidence.
Yeah, you bet. You bet. And I got to get out and walk this afternoon with try to be a good patient. That's the other thing of being on the other side of this is, not easy. Yes. And, remembering to take your medication and do what you're told, and no bending, it's a lot to remember. Mm-hmm. But I think summary, mark it down and ask questions, and this time I had, of course, the ID band, and everything's computerized, and the discharge summary was generated, and it's a totally different world than 20 years ago. And I'm happy to say pretty much everybody washed his hands.
Were you observing and
oh, you bet. Last time my wife, who's an internist, slept in a cot next to me to make sure. This time I said, honey, I think they got the hand washing down this time. Yeah.
Excellent. Wow.
So that's
so much progress. In a nutshell, what a great case study. We should write.
Yeah, we can't discount that hand washing. I mean, that's still pretty basic. And 20 years ago, it was a, sort of a crapshoot who washed his hands. This time I was paying close attention. Right.
Absolutely. I have so many more questions related to this, because obviously, we want to talk pop health, but I don't want to go there just yet. Let's talk about your book, because I know that's also very timely and time sensitive. How COVID crashed the system. So tell us more about, even kind of like how you came up with the title for the book, what you observed, and how do you think we're doing?
Well, first of all, thanks for asking. Let me show everybody the cool cover. So special thanks to our publisher, Roman and Littlefield in Maryland, who came up with the radar screen, and a little hard to see airplanes and viruses. So I got to give credit to Charles Wolfworth, my co-author. So here's the short story. Look, like everybody else, Friday, March 13th, 2020, it was a dark day. I came home from work just like everybody else in the world, and I thought, what the hell is this all about? And I was still pretty much involved in population health, and I had never heard of any of this, and I figured, this will be done in 2 weeks and we'll be back to work. And then all of a sudden it was, March, April, May, summer, late summer 2020. And Charles Wolforth, who lives in Princeton, I had known pre-COVID's award-winning science writer. And honestly, he called me and he said, look, we got to write a book about what's going on. And I'm like, oh, man, I'm so worried. My wife, we have 3 children. And as some folks know, one of our 3's a physician. And she was on the front lines at a great hospital, but didn't have sufficient PPE. And I mean, I was terrified. I mean, honestly, it was terror. And so when Charles called me, I thought, I'm not sure I could even do this. And he was really wonderful. He said, look, you're an important voice. I'll write it. You'll tell me and I'll put it into prose. And essentially, that's what we did. So for over a year together, we did a 90-minute Zoom call every week. And I had a great medical student, research assistant, Zach Goldberg. And the short story is we came up with this idea. And some of this, I got to give credit to people like John Nance and others. I said, listen, the healthcare system is an airplane that crashed and burned. And we're the NTSB, the guys with the black baseball hats. I'm wearing black, but they got like a black hat, says NTSB, National Transportation Safety Board. And we're crawling over the wreckage. There's dead bodies everywhere. It's still smoldering. And we're looking for the black box, right? And the punchline of the book is, we already know what's in that black box. For example, poverty, structural racism, underfunding of public health, no guidelines, a system all focused on doing procedures instead of keeping people healthy, a system with no chronic care infrastructure, not enough primary care doctors. I mean, it's a long list. So we know what crashed this plane. And now we got to figure out how to get this plane and planes like it back in the air. And that's the thesis of the book. And so half the book is a pretty sad story of what's broken. And that's kind of the Johnny Downer half. And the second half of the book is, okay, it's like a phoenix that's arisen. What are we going to do next time? And it's not about the pandemic per se. I'm not a COVID virus expert, but I am an expert on system failure. So this was galactic system failure. Other countries did a far better job than us for all kinds of good reasons. And then, for me, very personally, 1.2 million dead. I mean, so did they die in vain? That's the question. And sadly, as we say in the last chapter, when the dying stops, the forgetting begins. And we learned all this from mostly the Second World War. When the veterans came home in 1945 and 46, they didn't want to talk about what they had seen. And so we got to talk about it. And that's the thesis of the book. And so Charles is a magician because he took these Zoom calls and all the topics and all the research that we had done and turned it into fantastic prose. And then we, back and forth for months of editing the thing. And our editor at Roman and Littlefield came up with a good title, How COVID Crashed the System, and great graphics and research. We have 500 references. I mean, just managing the bibliography and the footnotes. Anyway, it was a great team effort. And I've written a bunch of books, but this was only my second mass market, as they call it, book. And then just to end the story about the book, typically these sort of publishers, they print 2,000 or 3,000 copies, and that's it. And we sold 4,000 copies in the first couple of months, so they had to go back and do a second printing, which was wonderful. All the proceeds go to Jefferson, every nickel. So I'm not lining my pocket. And I'm grateful for the reception. I mean, the book has been used in a bunch of medical schools and business schools. It won the AUPHA award this year, American Association of University Programs and Health Administration. It won a quality and safety award at the University of Jacksonville. So, 2 awards in the first year, pretty great. So, my job is to get people to listen and read the damn book. And so, successful mission. That's really was very gratifying for me. Really
there are things that when you were writing the book surprised even you, being in the system and seeing it implode and hearing the stories that your kid was telling you?
Stephanie. Oh my goodness. The good, the bad, and the ugly make your hair stand on end. I mean, what we saw even in our own town, we got 4 medical schools in Philadelphia, 2 of which are walking distance from one another. And the city government didn't know what the medical schools were doing, and the state government deferred to the city government and public health. And, despite heroic work on the part of everybody at the bedside, the system was a disaster. There was no way to take track of who got a vaccine and who didn't. And of course, in the minority communities, and our city is, 50+% of color, a lot of people said, I'm not getting a vaccine. I don't trust you guys at all. So we had to face that. And then all the misinformation that we were battling during this same time period when we were writing How COVID Crashed the System. I got appointed as the first ever, ready for this, the chief health advisor to the convention center in Philadelphia. Now, that doesn't sound like any big deal, but Boston and Philly are the 2 top scientific convention centers in America. So I had this other job of being the spokesperson for the convention center to dispel rumors and talk to potential exhibitors. And then our hotel industry collapsed. So I was in the middle of this, sort of ecosystem storm of what are we going to do moving forward. So to answer your question, Stephanie, I didn't know anything about this business. I had to learn pretty fast. And then we won an award. The Convention Bureau won an award for transparency and communication about COVID. And, we hardly remember what the hell happened 4 years ago. But that whole industry collapsed, and all of the workers, most of whom lived paycheck to paycheck, had no source of income, right? The hotels were closed. The convention center was closed, had to be redesigned, new HVAC system put in. I mean, and I dealt with, communicating all of this. So that was an amazing experience on top of doing the book. But the most amazing part was, all of my colleagues, I'm not at the bedside anymore. I mean, I practiced for 30 years and gave it up just before COVID because I wasn't going to be of any use clinically. And, we had colleagues who were living in a hotel because they were too scared to go home. I mean, unbelievable, right? And not just at Jefferson, but everywhere. And thankfully, my daughter never got sick, thank God for that. But look, 1 million+ dead. I mean, it's impossible to get your head around it, right? Combat casualties, both theaters, all of the Second World War is 500,000. Nobody gets this. So when you put it into perspective, I mean, it's a tragic loss. And then it became politicized. And of course, we don't have to talk about Dr. Fauci and all of that. So we had to battle the prejudices, and we talk about that in the book a little bit. But again, the book is all about system failure, not so much COVID per se, but COVID shined two spotlights on stuff that we all know. You don't have a primary care doctor. Oh, that's a big surprise. How are you supposed to get care? Oh, you're in private fee-for-service practice and your office is closed. Like, how are you supposed to survive that? Right. Or all of our hospitals, you're not doing any elective work. Well, how are you going to keep the doors open and not lay people off? So we struggled with all of that. And here we are, mostly post-COVID. Hopefully we're on more alert to what could happen. And these problems have not gone away. I mean, we're back to the RVU, fill the beds, get back to pre-COVID volume. And, come on, is that the right model for the future? Well, we could talk about it. I don't think so.
I think there's so many things in what you said that it just makes sense. Going back to when you said like everybody went home, like I just said that to my daughter like 2 days ago. She's 8. So, a lot of her life has been dealing with this.
Right.
And I said, like, that was so weird. We all just like went home and like it was the right thing to do. But like we just, our lives changed on a dime and everything evolved. But there are so many industries that did find new ways,
Yes.
I'm just thinking DoorDash, like there were so many evolutions, and restaurants were constantly confronted with new guidelines to stay open, and hospitals somehow still seem to struggle to get it together when everyone else is adapting. Even the technology, mRNA, which was in existence before, but really, I mean, they sped that up. We had some really remarkable things come out of COVID, but just what you said at the end, that people are saying like, we have to get back to pre-COVID levels. We can't do it the same. It's like your book, the plane crashed. We can't take those pieces and put them back together and glue them together.
Exactly.
The world changed. So we have to say, okay, this happened. We acknowledge it. Everyone else has moved on. What do we do? So is there anyone moving on who's successfully doing this, or how?
Yeah, so that's the key question, is are we really going to get to a world of whatever you want to call it, value-based care, population-based care? We coined the phrase no outcome, no income 12 years ago, right? We wrote the first textbook of population health more than a decade ago. We opened the first school of population health in 2009, 14 years ago. So, for me, selfishly, we were talking about this way before it was popular. And, back to 2020, like everyone else, I was sitting in my office at home, and honestly, people were Googling population health. What the hell is that? And our college and my name was at the bottom of the first page on Google when you Googled population health. So, all of a sudden, I was hearing from people literally all over the world. And so, excuse me. So on the one hand, wow, gratifying. On the other hand, gee whiz, we've been talking about this for 10 years. Where were you? So, I had a lot of ambivalence. I mean, frankly, I was like, okay, well, that's one way to finally, end your career and people getting interested, that a pandemic finally drove people to our front door. I mean, kind of sad, but all right, whatever it takes. And now our textbook is in 80 plus schools all around the country. There's at least 15 colleges of population health and 40 medical school departments of population health. I mean, none of this existed even 6 years ago. So COVID just was, in a weird way, like a rocket booster onto population health. But to answer your great question, Stephanie, where are we going with this crazy marketplace? Well, if we keep spending what we're spending, there'll be no end in sight. We could do more procedures, spinal fusion surgery. Thank goodness it exists. On the one hand, great. If I put my pop health hat on and you just look at our great city of Philadelphia, if you look at a map of Pennsylvania and you say, okay, let's rank all 67 counties from most healthy to least healthy. I mean, our viewers might be surprised to learn that Philadelphia County, home of Jefferson and 3 other big places, ranks dead last, number 67 out of 67. So, here we go again. I'm super ambivalent. I'm the beneficiary of great technology, which you could only get at a quaternary place. And on the other hand, our city is, suffering, and gun violence and poverty and all the rest, which can't be fixed by the healthcare system, but recognizing what drives, and you could call them the social determinants, or Don Berwick calls them the moral determinants of care, which is pretty amazing. That's the future. So if we can't fix these problems and feed people and give them a good job and reduce the racism and reach to the community, I mean, a handful of organizations are doing everything they can, including ours. And thinking about the equity question, maybe that's what will come out of COVID.
When I first had a chance to meet you in April in Philadelphia, it was discussing this very issue of health equity.
Exactly.
And we had Dr. Latif from Rush University, the CEO.
Yes. So for our listeners, Omar Latif and David Ansel, the whole team at Rush and Westside United, I mean, they've done a great job, and there are others, but I think in our sort of academic medical center ecosystem, they're one of the major leaders of really putting your money where your mouth is, and engaging the community and looking to the community as to what they need and putting them to work and measuring their health. It's a huge job, and it takes unbelievably great leadership like the team at Rush and Westside United. I'd like to see Westside United at every big place, every big hospital in America, and David Ansel, we got to call him out. I mean, Perv, he's been working on this for more than 10 years. Mm-hmm. You just don't decide and then tomorrow, get the community to trust you. This takes a decade's worth of work. And I'm proud that big places like ours and many others got it, and we got senior people engaged in health equity. We were not even talking about this even when we opened our college, 14 years ago. There was no such thing. So, okay, maybe that's a positive outcome from the pandemic. And we recognize that you can't have value without equity. I think that's a key message too, right? And if everybody's, you can't have value without equity. That's huge. And okay, now we need measures to prove it and experts to look at it and what's working and what's not. And surely telehealth is a big part of this. We got to make sure we're doing it right on telehealth. There's a whole social determinant of health industry. There's a value-based care consulting industry, billions of private equity and venture money pouring into both of these areas. Right now, it's more heat than light being generated. And let's be frank, big groups like Premier, and all the collaboratives, great step in the right direction, right? I mean, bringing these organizations together to share like we did in April in Philly, and learning from one another, benchmarking our performance. Nobody enjoys looking in the mirror for self-evaluation. Most people don't anyway. So being able to do that and learn from it and share the results, well, that will move the needle. So I'm optimistic about the future. Pretty good for an old guy. And one of the reasons I'm still working is, I love to be around young people. That's key for me. And our postdoc fellows, our medical students, the students in our college, house officers. These are the people I enjoy being with more than anybody else. And there's hope for the future, for sure. And in the last 2 chapters, we talk about changing healthcare education, doctors, nurses, pharmacists, everybody. So I'm hoping we'll build a new kind of professional for the future. That it would be great. That's the legacy.
It's an amazing story. Thank you so much for being here and sharing.
Great to be together. Yeah, thanks for letting me talk about my surgery too. Appreciate it.
Thank you for making it so personal. It's really a thrill to have you here.
You're welcome. You're welcome.
And thank you all for watching. We'll talk to you soon. Bye-bye.